Hello there. Welcome to another edition of our live Q&A here inside our Facebook Fit for Life Wellness group. So glad that you are here. I'm going to give everybody a few minutes to get the notification that we are live, and hopefully we'll have some friends join us, like Raven. Hi there. Okay, Raven was actually the inspiration for this question today, so I'll give her credit. And hopefully soon you'll see her smiling face on some of these Friday Live Q&As. But let's just, gentle reminder, when you come into the group, please say hi so that I can tell that you're here. As always, it's meant to be interactive, so if you have questions, please share them below in the comments section. And I'm excited to share with you today what we think physical therapy means to us. These questions are usually sparked by questions that we get in the office. And we had, as Raven reminded me, a few phone calls this week of patients inquiring about whether or not we were the right person for them. You know, it can be very frustrating when you're struggling with an injury or an illness or a condition and you're not sure where to go for help. And so we thought, what a great way to use this platform as a way to share with you all what we think physical therapy means. And so that's the topic for today's discussion. Before I get into that though, I had a couple announcements. I wanted to welcome, we've had several new people, not necessarily patients. We have had several new people join our group in the last few weeks. And I just wanted to remind everybody that there are several very valuable resources, and they're pinned to the top of this page. I think it's also called like a featured post. We have the ebook for Solving the Mystery of Back Pain available to all of you. There's a video, I think, on 3 tips to manage your nagging neck pain. We have information on how to fix your flat feet. What are the best stretches for the morning and the nighttime? There's more, but that's all I can think of right now. So you have access to all of that information, which is free to you, and it should be found at the top of this page. So make sure that you head up there and watch and look at those introductory posts. My second announcement is that we are so excited about how this transformation challenge is rolling out. Raven has been very busy getting patients started with our very first ever health and wellness challenge, and we have had several ladies get started already. We have room for one more. And so if you're sitting on the fence, if you're hesitant but curious, then comment stronger below this video. There was a video I recorded, I think it was 2 Fridays ago, so you can go back and watch it to learn some of the details. But really, we just need to get in touch with you. We want to get to know what your goals are, and then Jenna will give you a call and share some of the information, and then we really want to get you in the office so that you can meet Raven and talk with her, really to help you decide whether or not it would be a good fit. There's really nothing to lose, and we're really looking forward to sharing the transformation that these ladies get that are saying yes to themselves. And really that's what's happening for the 3 that have signed up so far, is that they're saying yes to themselves, and we're very, very excited about that. So we have room for 1 and maybe 2 more, but don't delay. And so that's my final plug for our transformation challenge. So we're going to talk today about what is physical therapy, and hopefully give you some insight onto the value that it can bring to your life if you've never been to physical therapy, but also the value that it brings to our life. So what I did first was a very quick Google search, right? I consulted Dr. Google, and here's what I learned. By definition, physical therapists are movement experts who improve the quality of life through prescribed exercises, hands-on care, and patient education. We diagnose and treat individuals of all ages from the newborn to patients nearing their end of life. That's a pretty good definition. In addition, or said another way, physical therapists evaluate and record progress. They help injured or ill people improve movement and manage pain. They are an important part of preventative care or rehabilitation and treat patients with chronic conditions, illnesses, or injuries. Also very helpful. Another source cited 5 things that physical therapists do. Number 1, we help regain movement and function after illness or injury. Number 2, we help patients with sports-related injuries. Number 3, we help patients with neck and back pain. Number 4, improve quality of life. And number 5, help reduce pain and improve joint function. I would say overall function, really. So that's a very good synopsis of the definition of what physical therapy means. Personally, I would say, and I know Raven would say, that that truly we do transform patients' lives with what we do. We help manage patients' pain. Oftentimes, we're the first one to sit and listen really to what they have to say and hear them and put our hands on them and touch them where it hurts and help them try to figure out what is going on instead of simply trying to manage their concerns with medication, injection, imaging. Those are sometimes necessary, but I think most importantly what we do is we give patients a safe place to heal, a safe place to be heard. And very often, by the time they get to us, they're frustrated because they've been from one person to another professional, still without really having an answer to what's ailing them. And so we help patients get with quality of life. We do help with pain management. We help with recovery of function from illness or injury. We help with longevity and wellness and prevention. And it's honestly, you've heard me say this if you've followed me for some time, we are movement experts. I tell my patients that there are a lot of different ways to describe what I do, but first of all, I have to be an expert in normal movement. We do have to be experts in normal movement so that we can identify abnormal movement. Another way to say that is we have to be really good at looking at the body and movement and seeing what's stuck and helping it get unstuck. That's a very simple way. Whether we're looking at bones or muscles or fascia or joints, we're looking for what's not moving right, and we're helping to encourage it to move where it's supposed to go, so we restore normal movement. And honestly, you know, the box I'd stand on if I could was that we really should be the go-to experts for people when pain and injury strikes. And most of us at this point now are doctors of physical therapy. And so we know when someone is presenting with a red flag or something that needs further imaging or investigation, and we can refer out to that. But patients could save valuable time and heartache and money, really, by going to see a physical therapy first. So that's my personal definition of what a physical therapist is and what we can do. And I know one of the other things I like to say is that physical therapy can also be therapy. It can also be a safe space to talk about your emotional hurts and things that are going on in your life. And many, many times patients have physical manifestations of their emotional pain. And I've had patients that have walked through painful things with me in my life that have blessed me. And I do believe that I have been blessed by patients who allowed me to walk through something very delicate and sensitive and painful in their life. And so it's a healing profession, and I feel blessed to be a physical therapist, and I know Raven does too. And we honestly value your time and attention and investment in your Planet Care when you come and see us, because we know you have a choice, and we feel very grateful that you've allowed us to be for 3 years now, your movement experts, and well, 3 years here at Fit for Life, but for both of us, Raven and myself, for longer than that. And we feel blessed, and we hope to continue to be your go-to provider. So that is my definition of what physical therapy is and what it means. And thank you guys so much for taking time to watch this. As always, if you have any questions, feel free to comment them below the video. We're always open to new questions and looking for ideas to come in here on Fridays at noon for these live Q&As. So the door is always open. Thank you guys so much for watching. I hope everybody stays warm and has a nice weekend, and we'll see you soon.